Hello, I'm Dr. Alan Gruning, and welcome to your Prescription for Health.
Hello and welcome to your Prescription for Health. I'm Dr. Alan Gruning. I'm a holistic physician practicing in Fort Myers and in Port Charlotte, Florida. And my practice is mostly dedicated to taking care of acute motor vehicle accident patients, but I also take care of really complicated people with fibromyalgia and chronic fatigue and autoimmune disorders and toxins and toxicity. And today we're going to be really focusing on more structural problems that people experience. And I've got a wonderful guest with me who I'll introduce here in a moment. But anyway, if you're new to our show, I hope that you'll check out our website, which is prescriptionforhealth.tv. And on our website, there's a whole host of great information that you can go, links that you can click on, different information about our sponsors. There's also ways that you can check out my video blog and our old shows on YouTube by clicking on the links to that. So I hope you go to the website and learn more about our TV show. And in addition, if you're someone who's a business person and you're thinking, you know, I really love Alan's show and I'd really like to see about being a sponsor on the show, please contact me. We are in need of another sponsor for the show, so I'd love to hear from you. Today, we're going to be specifically talking about structural problems that people experience with their neck and their back and their spine. And I've got a great guest with me today, so I hope you'll stay with us, Dr. Glen Schaffer. Glen, thank you for being with me here today on Prescription for Health. I've known Glen for years, and Glen's a chiropractic physician, and we're going to be talking about that. But Glen also works with me in my free medical clinic, which is called Southwest Florida Free Pain Clinic. And Glen has been involved with me since the beginning, 2 years. We're coming up on our 2-year anniversary for that. That's pretty exciting. And he comes and helps take care of people for free that are in pain at our free medical clinic. So, Glen, again, thanks for being with me here today. I guess getting started, tell me a little bit about how long you've been here in Florida and how you got involved as a chiropractic physician, why you decided to pursue that.
Well, thanks for having me on the show today. I've lived here in Fort Myers since the late '60s, so I've been here around a long time. But
you're a cracker, basically.
Yeah, almost. Wasn't actually born here, but my parents escaped the cold weather of the north like so many other folks, so they moved here in the late '60s. But I got involved in chiropractic. I always wanted to be in some type of health profession. I actually wanted to be a dentist for a long time.
Is that right? Yeah.
Somewhere along the way, I got diverted away from that, and my mom suggested I go visit her chiropractor here in Fort Myers, and I said, "Chiro what?" You know, I had no idea what chiropractic was.
Yeah.
But I went and visited him, Dr. Sam Watkins. He's a great guy. Helped many of us kind of get started in chiropractic. But I went and visited him for 2 or 3 days and just followed him around the office. And I said, you know, this chiropractic stuff looks pretty cool. You help lots of people. You don't have to cut them open. You don't have to inject them. You don't have to do any of that stuff. You know, I said, this looks like something that I'd be interested in. And that's how I got my direction towards chiropractic.
And then you had to go to chiropractic school for that. So tell me what's involved in the training to become a chiropractor.
It probably has changed a little bit since I went through chiropractic college, but most schools require several years of undergraduate study, kind of get some of those basic science things out of the way. Most of the chiropractic programs are 3 or 4, or there may even be some now that are kind of 5-year type programs. So you get a lot of the similar training that you had going through school, learning all of the anatomies and the physiologies and the biologies and all of that aspect of it, where we focus more in you know, holistic type of treatment, and some of the allopathics go towards the, you know, the medications and surgeries and that type of thing. So
Correct.
Our training is very similar, you know, in the medical training in terms of having to learn about all of the disease processes, etc. But it focuses more in the holistic, natural approach.
And that we have a very similar path with that, because as an osteopathic physician, that's how I was brought up, is to try to seek other more natural ways to help people to get better. In my practice now, that's what I really try to focus on, is holistic natural treatment. So we have a lot of similar interests in that. And chiropractors are for the most part known about crunching people, but it's a lot more than that,
don't
isn't
talk
it?
like that. No.
It's a lot more than that. I mean, that's kind of what everybody's, oh, I want to go to a chiropractor and get cracked. But it's a lot more than that, isn't it?
Oh, absolutely. Chiropractic is really about 120 years old. Started out with, the spine, and that's still the emphasis of most chiropractors today, is focusing on the spine. And the spine holds the nervous system that kind of runs everything in the body. Although people come in because they're hurting, we have to get at the original problem. What's causing your pain? What's causing your symptom? And treat the specific cause versus try to treat them symptomatically. Oh, you have this pain, let's treat this pain. What's really causing your pain? But the root and the foundation, the philosophy of chiropractic centers around the spine and the nerves that exit the spine, trying to keep the spine healthy and simplifying it.
So what is probably the most common problem that people come to you for?
There's probably a top three between neck conditions. They've got neck pain and headaches, maybe lower back pain. They may have a sciatic problem where they've got some pain going down in the leg, or maybe even pain going down into an arm. That type of problem. And then we do see a lot of musculoskeletal conditions. As far as hips are probably the biggest thing that we work on. Hip pain. People don't necessarily understand it's coming from their hip, but they come in because they have this kind of lower quadrant back, type pain that hurts them during certain movements, and we have to find out exactly where that's coming from. And many times it's coming in part from, a hip that's starting to go bad a little bit.
Right. And we see very similar problems at our free clinic, don't we?
Oh, absolutely.
We see people there who have been suffering from neck or back problems or just chronic pain for years and years and years, and that's a little bit different situation, because there we don't have people who have had access to the best health care. They don't have health insurance, they don't have anything, and for the most part they're relying on free medical care now, us, to try to help them get better, because they have no other place to go.
Absolutely.
So we see some pretty desperate people there.
Yeah, we sure do. Some pretty amazing cases. But the part of it that I like, as far as chiropractic, you have to educate people like you do in your practice towards, here's what's really a healthy way to go with your life, and compared to maybe how they've been living their lifestyle. I look at what I call the 5 pillars of health and try to, at least in some part, investigate those things with each patient that comes through.
Go ahead and talk about those 5 pillars.
The 5 pillars. All right, let me see if I remember now. Proper exercise, proper nutrition, proper rest. There's proper mental, spiritual well-being, and then there's proper structure. And the structure is kind of what they equate with chiropractic care. I've got a structural problem. I have something going wrong in my musculoskeletal system, and they come in for that. But when you look at those other areas, and so many conditions can be kind of put into those 5 areas. There's maybe a 6th one I came up with recently, which is putting junk in your body. The junk that we put in. So, but that kind of fits in the nutrition area. Putting good stuff in and not putting in things that we know are kind of toxic. But if you look at those 5 big areas, and I was sitting at a convention not too long ago, and the speaker was talking about all of the top 10 health conditions that we spend the most money on in the United States.
Right.
Over $500 billion a year. Most of those could be helped if you just address those 5 areas.
Correct.
And we think of them all, obesity, heart disease, diabetes, the musculoskeletal, they really, a good chunk of them fit within those 5 areas if we focus on those things.
Absolutely.
People don't get enough exercise. Getting someone to take a walk to their mailbox and back sometimes is a big accomplishment for them. But if you don't use the body, the way it was designed, God created this thing to be used, and if we don't use it, it starts to suffer. It starts to develop problems. If we don't put the right food in it, it starts to develop problems. If we do all those things great, but we're not getting proper rest every night, our health starts to suffer. We start developing different problems. If we do all those things right, but we're stressed out, and mentally we start developing problems. And then the structure, you know, again, we go back to the spine, we go to the musculoskeletal system, our nervous system is intertwined, you know, with every area of the body, and you've got to make sure that nervous system is functioning at its best. It connects the brain to everything in the body. So if there's any issues with the nervous system or disruption in that nervous flow from the brain to the body or back up to the brain, they end up with health problems as well. So if we miss one little area, it could be a real key component to that person, you know, becoming more optimally healthy or, you know, getting back on the road to health. So you got to address all of those things.
You've got to address all of it. And I think that's where, not to throw stones at people, but that's where most of the people in the healthcare system, doctors, nurse practitioners, PAs, whoever, are focusing on symptom management, and they're not really focusing on fixing the underlying condition, and they somehow divorce what's going on with this from their nutrition and exercise and sleep patterns and all the other things that we're talking about, when it really is treating the whole person. And your emotional life, your spiritual life is a big part of that, as you well understand.
Absolutely.
Because I know that you address that with your patients.
Yeah, we sure do. I mean, all of those things are important, and you know, I'm certainly not against surgery. Surgeries are necessary. Medical doctors are necessary. I try to work with, you know, the patient's medical doctor. Sometimes they understand kind of what we're trying to accomplish with chiropractic. Other times they just say, don't ever go to a chiropractor. That doesn't happen as much anymore as it used to. You know, there's a place for, you know, medical doctors and treating symptoms. If someone is in so much pain, they can't sleep, they can't function, they need some help from that. Hopefully temporarily, you know, and medications are a good place to utilize some of these things where we can get them through a particular area. But the person would obviously be better off if they did not need to take those medications, and that's our goal, is to try to decrease what they're having to take.
So kind of real quickly, before we go to commercial break here, tell us a little bit about what a disc injury is, because people know that, they've heard of that, they may have been told that, they may have been told they have a bulging disc, a herniated disc. Does that mean that they have to have surgery? I mean, tell me what's involved in that.
Most of the disc problems do not need surgery. Obviously, there are some cases that do, and we see those in our office you know, periodically, but most of them can be treated without surgery. The spine is made up of 24 vertebrae. There's a little pad or a cushion in between every one of these vertebrae. So it gives a little shock absorption, keeps the vertebrae, you know, separated enough so that there's openings for the nerves that exit the spine on both sides. We have nerves that come out to go to every different part of your body, kind of connecting your brain. But anyway, these intervertebral discs, these discs are the little cushions in there. They're very much like a jelly donut. And if you could take that and lay it out on the table, it's got an actual jelly center to it that is supposed to be right in the center of the disc. But as we kind of put stress and strain on our body, or if we've had an acute injury, there's little circular rings of fiber inside that disc. Kind of looks like a tree stump if you cut it off. Got those rings in there that keep that jelly in the center. Those little rings start to tear, either from just chronic use, you know, over and over, or from an acute injury. And they would allow that jelly to kind of move right from the center of the disc towards the edge of the disc. And just like a jelly donut, if we have one sitting on the table here and we put some pressure down on it and it didn't have the little hole that they stick the jelly in, eventually that jelly is going to start to squish towards the edge. And as it does, it'll start to bulge that donut. And that's kind of a good visual picture of a bulging disc. If I keep pressing down on that donut and that jelly squirts out, that's a herniated disc. And it kind of looks, I don't know if you can see that on the camera, but it kind of looks like that little red area can actually squirt out. And depending on where that, you know, either bulges, you know, or squirts out, where is it going to press on your nervous system? You know, is it going to press back on the spinal cord? Is it going to press on one or more of these nerves as they exit the spine? And you can get resultant, you know, leg pain if it's in the lumbar spine, the lower back, or if it's in the neck, it can go down into the arm, you know, depending on where that goes. So,
and that's how people come and present to us, is with pain, but we have to look at all the pathology that goes on behind that. And it could be a disc, it could be just a muscle injury, it could be a joint that's out of alignment.
A lot of things can press on the nerve that mimic, you know, the leg pain and arm pain. So that's part of what we have to figure out. What is actually pressing on your nerve? You know, and last part of our diagnostic testing, the physical examination that we'll do on a patient. A lot of times you can almost figure it out from what they're telling you and when it hurts and when it doesn't hurt and that type of thing. So that's kind of how that goes. The other aspect, which is not the herniated disc, but this is kind of like a little rubber bushing, and as time goes on, you'll see a lot of these degenerated discs. Well, I got a degenerated disc in my back. It's simply this thing is kind of worn out a little bit. On X-ray, you'll see the edges of these vertebrae become very rough. Sometimes we'll see some calcium deposits, some little spurs that form, and they can develop in any different direction, but that's that degenerated disc. So sometimes I'll give you a good example. You ask, can these be helped without surgery? Because we see a lot of these patients that come in and their history is, well, my back started hurting a month ago. Prior to that, you have much trouble? No, I didn't have much trouble with it. So, but when you look at an X-ray, you see a condition, a degenerating disc that took 15 or 20 years to get that bad. That's what we're now seeing. So 2 months ago, you felt pretty good, but you still had this degenerated disc in your back. So my job is I can't give them a new disc. I can't get this thing looking 20 years old again. What can I do? And that's what we tell almost all of the patients is my job is to get that area functioning a little better. Because sometimes it looks like they're almost bone on an X-ray, but if you get it functioning just a little bit better, a little better function to that spot, guess what? They feel better. A lot better.
Well, we're going to go ahead and take a quick break here and go to our sponsors and some of the commercials, and then when we come back, Glenn is going to demonstrate to us some chiropractic techniques on the table. Be right back. Medicine Shop Pharmacy has been serving Charlotte County for 27 years with the same owner and pharmacist, Wayne Wallace. They offer the personalized service of a small-town pharmacy, but the buying power of a large chain to keep prices low. Medicine Shop specializes in compounding medication, which means custom making them for each patient, including bioidentical hormones. They even have free delivery. Medicine Shop is located on US 41 in Port Charlotte. Call them at 941-627-9855. Metagenics is a worldwide supplement company that offers better health through nutrition and lifestyle medicine. Its high-quality products are designed to help doctors and healthcare professionals offer safe, effective, and more natural approaches to their patients. Metagenics is an industry leader in metabolic detoxification, something we all need because of our toxic environment. They also have numerous supplements to treat illness and maintain health. Metagenics products are only available through healthcare practitioners. To find the one closest to you, go to their website at metagenics.com. When it comes to health and aging, our bodies are under constant attack. Free radicals are your health's #1 enemy. Now there's overwhelming science pointing to antioxidants as the ultimate solution to this free radical assault. The great news is that cocoa is the most powerful antioxidant superfood on the planet. That's right, chocolate. But not just any chocolate, only one chocolate. Shosai is recognized by the U.S. Trademark and Patent Office as healthy chocolate. Shosai is cold-processed cocoa with acai and blueberry. It is delicious. All of the Shosai products proudly display their certified levels of flavonoids and antioxidants. They're among the highest scores of any foods in the world. Are you concerned about your health? You must eat more antioxidants. Why not eat Shosai, the healthy chocolate? To try Shosai, to get more information, or to learn how to build your own part-time business and residual income as part of my team, call 1-800-996-5383 or visit our website, hcinfo.net. Welcome back. I'm Dr. Alan Gruning. We're here with Dr. Glen Schaffer today, a dear friend of mine who's a chiropractic specialist, and we're going to be demonstrating some techniques on our model here, Paul Lodato, station manager of WRXY. And we're going to be looking at some ways that we can try to relieve neck and back pain from a more natural, non-invasive way. So Glenn, I'm going to hand it over to you, and let's see what kind of pathology he has.
Well, I got an eager victim here, patient, excuse me. One of the things that we look for in chiropractic, our terminology is a little bit different. We take misalignments in the spine, we call that a subluxation. Big $10 word that lets us charge more if we use it, but we find these vertebrae that are a little misaligned, they're not working right. Any area that's not working right, be it your shoulder, your hip, your neck, whatever it is, the muscles tighten up around that spot to guard, protect, try and correct that problem. So they're real easy for the trained chiropractic fingers to find, and boy, sure enough, we found one right here in your neck. We have several different techniques. All chiropractors kind of have a toolbox of techniques that we can use. We all don't use the same technique, but they're all designed to do the same thing, which is to get a little better alignment, a little better function to that. One of the tools that I use periodically, called an activator, real simply, it's just a little adjusting tool. I could do that in the sitting position. So I could have a patient maybe that doesn't get down real easily on the table for whatever reason. Maybe they're in a wheelchair. We have some that come to the free clinic that don't get out of their wheelchair. So we have some tools, some ways that we can be able to adjust that patient regardless of what their condition is.
And what is the activator actually doing?
It just has a little bit of a force. It does a little bit of an adjustment, so I can very specifically, I can decrease the amount of that force. I can direct it in a different way if I need to. So we can utilize it on the spine. We can utilize it on a different joint in the extremity. On the jaw joint, we can utilize it. There's a lot of different places that we can utilize this little tool. So it's just a tool. Some people come in and they prefer this tool. They say, do you use activator? Oh, I do use activator. I prefer using my hand, but they prefer the activator, so absolutely, I'm going to use the activator on you. I've got one. Because
it's a little gentler, and some people are afraid of the manipulation.
Absolutely. And there are some people that if you're actually working on them, you hear a little crack or something, you start worrying. So that's when you want to use the activator. So, but anyway. But the typical way that we would work on it is we'd have the patient lay down on their stomach. So I'm going to let you lay down on your stomach, head down at that end. Yeah. And again, I'll let you look straight down in there. So look straight down on the table there for me. There we go. I'll palpate the spine. I'll feel some areas that where I feel that muscle guarding. I might feel that. We do what's called an adjustment on that patient. Take a nice deep breath in and let that breath out. There we go. We'll do a little adjustment on that spot. And that we have some other decompression type treatments, would be on a little different table. This is simply a portable table that we're using today. But for those bulging and degenerated discs, we use a decompression type table, which kind of opens up and separates those intervertebral discs in the lower back. You can kind of move that table around, manipulate that, get it functioning better. It creates a little negative pressure inside of the disc. So you think of that jelly donut that's got a little bulge in it, and you're creating some negative pressure inside the disc. It helps to kind of pull some of that bulge back in, allows some of the natural flow of fluids in and out of that disc a little bit, stretches some of the ligaments that might be compressing on that. In addition, we may use some physical therapy modalities if they've got a real spastic, swollen area, similar to what we do, in the free clinic. We get an area that's real hot, so to speak. It's inflamed, and you want to calm it down. So that's our first step with, most of our patients are in pain, so we want to get that area calmed down. We want to get things lined up, moving better. Then lastly, make sure it just stays that way. In other words, if you have a degenerated disc in your lower back, it's never going to be truly healthy. It's going to always be degenerated. So what can we now do, and what can we teach the patient to do on his own to try to keep that area as healthy as possible, functioning for the duration? So that's kind of the final phase of most of our treatment plans, is to keep things healthy, which requires probably more work on his part than my part. They may come to see me periodically, but it's making sure they're doing some of those 5 pillars of health.
And the exercise component of that is really big.
Exactly.
So listen, I really got to see you do some painful stuff to Paul here. So so let's see if we can get his neck adjusted. I know you found a bad spot up in there.
All right.
Do you want him on his back or?
No, I'll do it just like this, so we don't see his grimacing face as I do.
He's great.
Right. So anyway, this is kind of similar how we would do that. Very similar to that. So.
And that's very specific for that spot that you found that was misaligned.
Exactly. So, and we have, like I say, in chiropractic, we have lots of different techniques. You could go to 10 different chiropractors that maybe even went to the same school. It would feel a little different as they worked on it. They may use a little different technique on them than I just did. But they're all designed to kind of do the same thing. Get the bone line back up better, get it moving better. Sometimes the vertebrae, or maybe it's a hip or whatever, it's perfectly lined up. It's not an alignment problem, it's a function problem. So all of the joints, especially the spine, are very dynamic. They have to move. You know, and that's the problem with a lot of these things. They're lined up, but they're not moving properly. So we've got to get things moving, and get that joint
DOs
moving.
call those restrictions, but it's the same kind of thing that you're talking about.
We find these areas of restriction and get them moving better.
So maybe we can try to show a lumbar technique.
Oh, okay. All right. Let's.
I know this is not the optimum table for that, but.
All right, Mr. Paul, lay on that right side for me. So that side down, you'll lay and face me this way. There we go. Bring that arm underneath.
So this is if he was having some lower back pain, maybe leg pain.
Depending on what I found, but this is one of those techniques to work on that. I'd find the area of misalignment. We're always kind of contacting with our hand, using a little leverage to just kind of adjust that area, similar to that.
Cool.
So that's kind of how it goes. But again, we have a variety of techniques that we can utilize.
And he's not screaming, he's actually smiling.
He's actually smiling down there. How about that?
That's
You can swing around and sit up there.
All right.
So give him a big hand there.
Yay, Paul, you did great.
They're the best.
Now also I know that you guys, chiropractors in general, as well as DOs, we're big believers in massage therapy. We have a lot of respect for massage therapists and what they do.
Well, my belief, because any area that's not working right, the muscles tighten up around that area to guard and protect it. Well, muscles are not designed to be tight all the time. And the metabolism in the muscle starts to build up some lactic acid and other things. So my theory is that chiropractic and massage help each other. You know, so when I do the adjustment and I've got a little better motion here, that muscle, if we can use the massage on it, will help to kind of get some of those toxins out of the muscle, get that muscle back to a little better muscle tone. Many times I'll have the massage therapist work on them before I do to relax them a little bit more. My adjustment goes a little bit easier. But if you're going to a massage therapist and you keep having pain and tightness, it could be because something's not quite working right in the bony structure. So if you get that area working better, your massages will work better also. So they augment each other. They help each other. And that's what I found in my practice, because we do have a massage therapist in our office as well.
In our free clinic, we're blessed to have the Heritage Massage School.
Room of
we have a whole
massage
room
therapists,
of massage therapists. We have the whole school there on Tuesday nights, and the students are working on the patients, and it's just a great opportunity. But that is exactly what happens. We get the patients loosened up with stretching, with massage, now we have ultrasound available, and then you can do manipulation with them much easier, and the patients walk out and they feel better. And then we teach them exercises, like you said is very important, to keep them functioning well so they don't keep relapsing.
And one of the things that I try to explain to my patients, you know, sometimes we'll find something that's been there a while. You know, it's not like they just woke up and thought, oh, wow, something just went out of place. Most of these things have been there for a little while. So it's kind of like going into the gym and getting back in shape. You know, it doesn't happen overnight.
Correct.
So it's a process of trying to kind of rehabilitate an area, get it functioning and more stable again. So it doesn't happen overnight.
Correct. Well, I really appreciate, Glenn, you being with me here today. It's been great. And Glenn and I have a very similar philosophy, which is a very holistic philosophy, that you are more than just a physical person. You're a body, a mind, and a spirit. And if you're not sure about what's going on in your spiritual life, and it's not the most balanced spiritual life that you can have, which, by the way, only happens through a dynamic relationship with Jesus Christ, go to my website at prescriptionforhealth.tv. Check on the link that I have there about how to have spiritual health, and learn more about how you can bring that dynamic into your life, because it's going to help you physically and emotionally as well. Again, I want to thank you for joining the show today. Thank you, Dr. Glen Schaffer, and his information has been on the screen. Call him if you need some chiropractic help. He's a great guy. And thanks for our model, Paul Lodato, for helping us today. This has been Dr. Alan Gruning, and thank you for joining us on Prescription for Health. Thank you for watching Prescription for Health, Southwest Florida's local weekly TV program devoted to holistic health and healing. This is an outreach of Christian Health Ministries, dedicated to providing free medical care to the poor and uninsured of Southwest Florida who are in pain. If you would like to give toward the work of our free clinic, please send your tax-deductible donation to the address on the screen. God bless you on your journey toward better health.